did a pap smear, which was basically like a Q-tip into your bottom, and he saw some areas that looked like, or not saw, but the swab showed, yeah. Oh, thank you. Showed some areas that looked like it could be pre-cancer. So he wanted us to just take a look to see if there really are any areas that look like pre-cancer.
I hope it's not no cancer.
It's most likely not, right? That's very unlikely. This is really about preventing. So it's all about prevention.
Okay.
So, on the anal pap smear, when they do find the pre-cancer areas, a lot of times we will as well find pre-cancer areas. And if we do, we'll have a conversation about how those get removed and treated. But we're not going to do that treatment today. It's just really going to be about taking a look.
Okay.
And so sometimes we'll have to take little biopsies on the inside. Typically the biopsies are not painful. On the outside, if we see anything, that can be painful, so we would do a numbing injection, and we would obviously talk to you before we do any kind of biopsies.
Okay.
All right. Let me just ask a few questions. What do you take for your HIV?
I take Bartarvi.
Biktarvy, okay. And do you know what your last viral load was?
Non-detectable.
Undetectable. Wonderful. And do you know what your T cells are?
It's on my chart.
Okay.
I'm
do you
not.
know if they're high, like above 200 or not sure?
It's non-detectable, so I'm pretty sure the levels are high.
Okay. So you've been undetectable for a little while now. Okay. How long have you had HIV, or like when did you?
I found out I had HIV 2013.
Okay.
So over 10 years.
And any problems in the anal area that you've been having? Any lumps, bumps, bleeding, pain? No. Okay. Great. And no discharge or anything like that. All right. Any smoking?
I do smoke. I smoke cigarettes and weed.
Okay.
So I smoke daily.
Got it. Okay. And then any warts that you've had that you know of in your bottom or penis or anything like that? Genitals? No. Okay. All right. I know I'm forgetting things, but anyway, all right. So basically the idea would be, since you already have the anal pap, we don't need to repeat that today. I think you also had gonorrhea chlamydia testing with that doctor.
And that was all good.
Yeah.
So I'm glad of that. No STDs, none of that.
It sounds like the syphilis, right? Was it a syphilis?
Question of syphilis?
Questionable, because I had it before. So that's why he said that it might pop up. But I already got shots for it and everything like that, but it says it's still going to be in the system. So I had it before.
I think the issue was that the numbers went up.
Yeah,
it does show up in the system, but we look at those numbers and it sounds like the numbers increased. Okay. Which would mean that you should probably get treated. We just have to figure out how. Okay. Because there's been a recall in penicillin. All right. Anyway, so basically the procedure you're going to be, it's a little bit, you're sort of open to us, all right? You're going to be on your knees in front of us with your butt up in the air, basically. We're going to, with a finger, do some numbing medicine just to kind of numb up the area. We do like a rectal exam, basically. And then we're going to put in a small plastic tube. It's just like 1 to 2 inches in. And then we put in some like vinegar solution and an iodine solution, that kind of stuff, where we can just kind of take a better look. Okay. And then we see if any biopsies need to be taken. Most likely there will be a biopsy or two.
What that mean?
Like we take a little piece of tissue. Like
cutting the tissue out of my.
Exactly. Yeah. Like I said, on the inside you don't really feel it so much, but obviously if you feel it, you speak up, right? You let us know.
So I'm trying to understand, because this is the first time I ever had this. Sure. I know they did the smear or whatever for like just to check and see, because I'm getting up at age 35, 40, so like they told me that I need to do that. Yeah. But I just need to know like what exactly is going to happen. What's going to be happening?
Right. Okay, so what's going to happen is you're going to be wearing a gown. You're going to have your underwear and your pants and your shoes off, and you're going to have the booties on your feet. You're going to keep your shirt on.
Okay.
You're gonna, then Diane's gonna bring you, the nurse is gonna bring you into the room, and there's a table that's there. You're gonna be awake the whole time. You're gonna, there's like a stool, a sort of thing where you put your knees, and then you kind of lie flat on the table, your butt's up in the air, and then basically we start the exam. So it's called an anoscope is the machine that we use. That's not going into you. What goes into you is the finger first, and then the scope called the anoscope, which is just a very small tube. And that goes in, it goes in like sort of 2 to 3 times basically, throughout the whole procedure. And then we put in, like I said, those solutions, like vinegar solution and then an iodine solution. And then we just look and see if we see anything where we need to take a little piece.
Okay.
Right, and then those pieces get sent to the lab. It can take like a week or 2 for those results to come back. And then based on those results, we talk to you about like what the plan would be for if you need any kind of treatment or if we want to see you back, that kind of stuff.
Okay.
That way